Hello everyone. I'd like to welcome you to today's webinar, Stay Compliant, Affordable Care Act Requirements for Dynamics GP. We appreciate you taking the time out of your schedule to join us today. There are a couple of housekeeping items we would like to mention before we begin the presentation. All attendees are in listen-only mode. If you have any questions throughout the presentation, please either raise your hand so that we can unmute you, or you can submit them through the GoToWebinar question box. We will be answering questions throughout the presentation and will also be following up after the presentation to answer any additional questions. I'd like to introduce today's speaker. We have Christopher Kubala, who is a GP Senior Consultant here at Socius. So at this point, Christopher, I believe we're ready to transition the presentation over to you.
Thank you, Lindsay, and thank you everyone for joining. The goals for today is to actually understand the basics of the Affordable Care Act. I will say that knowing that there was just a recent election for everyone, there could be some changes upcoming, but there are some changes for this next year that we do want to touch on and how that affects your Microsoft Dynamics GP reporting. We want to go through the standard GP capabilities for tracking and reporting Affordable Care Act information for those employees, and want to go through some of those reporting requirements for this next year and make sure that everyone is able to report that out of Dynamics GP. A little bit about the Affordable Care Act. Some people do call it Obamacare, so you may hear both. But the Affordable Care Act currently applies to any employer with 50 full-time equivalent employees. And what that means is if you have part-time employees or a mix of part-time and full-time employees, it is 50 full-time equivalents. So it's based on 30 hours per week for those employees. If you have 2 employees working 15 hours, that combines to 1 full-time equivalent. So anybody who does have 50 or more full-time employees, the Affordable Care Act will apply to those employers. We have heard that that number will change over the next year or so, but that may change now thanks to the election. But anybody 50 full-time employees, that does not necessarily mean the number of W-2s that you are reporting, though. So again, it's a little bit different between full-time employees and the number of W-2s that you cut throughout the year. Another piece here is that it does contain the requirements for health insurance coverage along with reporting. So if you go through the full Affordable Care Act piece in documentation legislation, it does include what needs to be covered, what doesn't. But our recommendation from a consultant standpoint is certainly talk to your plan administrator. The insurance plan administrators are going to have the most amount of information for you. As we go through some of the setup screens for GP in particular, those plan administrators will be able to help you with codes and what meets qualifications and what you need to report on and what those numbers are. They're going to go in the miscellaneous boxes that we talk about as we go through here. Previously, last year when you were reporting, if you did report and you were covered under the ACA, there was a good faith effort. What that meant was that the government was willing to give you an opportunity to try to resolve everything, make sure that you were reporting to the best of your abilities, and that the information that you provided was done in good faith. That meant that you weren't excluding anyone or voluntarily not reporting. Those things would not have been covered under a good faith effort, but you were trying to do the best you can, and that was for last year. Some of the changes for this year, that good faith effort has actually expired. So there are some changes that we're going to see for this year's reporting, and good faith effort is one of them. So the government is saying that you need to report, and you'll need to report completed, correct information. The good faith effort has since expired for that transition period. One of the big changes, penalties have increased. So previously, I believe it was $100 per return. It's now $260 per return, up to a company maximum of $3.93 million for failure to furnish. Again, that's corrected 1094s, 1095s. If you intentionally do not file, it's $530 per return. So the fines have gone up significantly over this last year, so that we do want to make sure that everyone is aware of what those are, and why we're having this webinar now is so that you can start to look at that data ahead of time, so that way you're not caught in a lurch later. And one of the changes from last year, if you do remember, the federal government did give a little bit of a reprieve towards the end of the year and pushed back filing for 1094s and 1095s. That is not the case for this year. W-2s, 1095s are all due to the individuals by January 31st. So that information will obviously need to be correct based on the penalties that have been set forward, along with then correct information in the employee's hands going forward. So a little bit of a change from last year that we'll want to make sure that everybody takes into account. In order to make that happen, we do recommend that everyone starts to look at their Dynamics GP version. GP is currently supporting Affordable Care Act for Dynamics GP 2013, 2015, and 2016. So the three current versions that are out there and available for payroll updates at the end of the year are ACA compliant. If you're on an older version of GP and utilizing it for payroll, GP 9, 10, 2010, all of those are not compliant for the Affordable Care Act changes, so you'll want to talk to your account manager or consultant pretty soon in order to get yourself up onto a supported version. One of the other requirements in order to get the full ACA compliance reporting is that two modules are installed. One is the Human Resource module. A lot of the data that is pulled into GP for ACA compliance and ACA reporting is based on human resource information. Even if you're not using the full-blown capabilities of human resources within Dynamics GP, both of these modules will need to be installed. If you have any questions on whether or not it is installed, obviously reach out to your associates consultant to take a look at it, and they can help you identify whether or not it's in there. But when you see some of the screens that we'll go through here in a little bit, it may help you identify whether or not that human resource module is installed. If it's not, then the ACA reporting requirements are not set up and configured in your existing environment, so you'll want to reach out to somebody to get some help with that. And one of the first requirements will be to reconcile your benefits and payroll to those HR modules. So once you get those pieces in, one of the first steps is to get it set up and connected is actually take the benefits in your payroll module and reconcile those over to the HR side so that you can start to get HR set up, taken care of. Next, we're going to go through some of the requirements and setup screens within Dynamics GP. If you do have the Human Resource module installed, along with that reconciliation and deduction and arrears taken care of, your screens should look pretty similar to this. It may be slightly different based on the version that you're on for Dynamics GP. This is actually with 2016, which is the latest version currently out there, but the screens should look pretty similar at this point. So within the health insurance setup, the reconciliation will take the payroll data and move it over to HR, and the HR information for this screen will need to be completed. You'll see a new box down here along the right-hand side called Affordable Care Act info. This is actually going to base your information for your Affordable Care Act reporting. So you'll see a couple pieces in here, but the pieces that it does care about is going to be your Affordable Care Act info. Again, we recommend highly that you talk to your plan administrator, but these default setups will be available for anyone who utilized this code. So once you complete your reconciliation from payroll to HR, your codes will then move over to the HR side, and these pieces of information will be completed. We'll want to complete the offer of coverage, line 14, safe harbor codes, line 16, and lowest cost premium. Again, please talk to your plan administrator for those specific codes, and this is all completing for the default information going forward. So this will make your setup a little bit easier as you continue. From here, information would then be rolled down to employee cards. We'll talk about that here in a couple minutes. But we would want to set this up for the majority of your employees. So if you have the majority of employees who use single coverage, then you'd want to set these codes up for 14 and 16 to refer to single coverage. Or if the majority of your employees don't select coverage, you'd want to set those up also. The lowest cost premium is the lowest cost available to your employees, whether or not they choose this coverage. So if they have a coverage plan available, the lowest cost premium would go into this piece. So even though an employee may take out higher or lower or choose a plan that is higher or lower based on their own personal selections, the lowest cost premium is the amount that is offered to them. So if I choose an insurance plan that is $100 per pay period and I have a plan option that is $40 per period, my lowest cost premium is a $40 plan. I have options to take that plan. It is my option to pick the higher plan and the higher dollar amount. So as you go through that, again, talk to your plan administrator to get those codes worked out, but that's how those pieces will pull across for the reporting. After you have your deductions set up, or sorry, benefits set up within the HR module, the next part is to assign those to specific employees. As you can see here, we still have the same benefit name of INS and a sample employee. This is through the benefit enrollment screen within HR, within the HR module. So you would select your employee and add that benefit code to each one of those employees in order to roll those changes down. A screen will pop up saying, do you want to use the default information? You can say yes, and it will add that to the screen. You'll see again then the Affordable Care Act information screen has, or box, has now the codes 1A, 2A, and the lowest cost premium for my Affordable Care Act reporting. This will roll down from that setup screen that we just had up and available. You can change any of the information on this screen to reflect what those would be for that specific employee. So if line 14 needed to be changed so that the coverage was for the full family, you could select that offer of coverage for full family as compared to single. Or that if the employee has waived coverage, you can mark this as waived coverage. This screen does become important as you continue through the year, in that any changes made to this screen are reflected on that report through the end of the year. So the idea is to get this thing set up for each and every one of your employees as early as possible, and through the course of the year, any changes that are made to the coverage or coverage plan, enrollment for open enrollment, or a qualifying event that may need you to change the information, this is changed timely. What you can do is continue to mark this throughout the year. If maybe a qualifying event happens and your employee then changes to a full family plan, you can open this screen up and change that 1A in order to reflect the full family coverage. In the background, GP will then note that this employee has gone from one code to another, and you'll see it reflected at the end of the year on your reports, so that it is a difference, so that you've been on one code for the first couple months, it then changes to a different code, and maybe a third qualifying event for open enrollment happens at the end of the year, and you'll see a third code changed throughout the course of the year. If the lowest cost premium changes, you can roll it down from the setup screen, or you can go to each employee and change it on their individual screens in order to push that piece along. Again, it's going to be a series of changes throughout the course of the year. For the ACA reports, though, it will be as if they were covered for a full month. So it does care when that's changed in the system, but if you were covered for one day within that month, it's coverage for the full month. It's not coverage for half of the month and then a second half of the month. So it does care if you were covered or not covered for the full month. One of the other reporting requirements will be the employee dependents. So in HR, there is a dependent screen. You'll see one that I've pulled up here as a representative sample. We've got 3 dependents for this employee, and you'll see along the right-hand side it says health insurance coverage, whether or not that employee covers and the health insurance covers that dependent. For self-insured businesses, you do need to report all of the dependents that are on that plan. So there'll be some settings later that you'll see for the reports, but we do recommend that you start to track employee dependents when they're on your coverage plan. One of our tips and tricks is to actually just reach out to your plan administrator if you have any questions of who's on the plan and who's not. Usually those plan administrators will be able to pull a report that has all of the employee dependents on it. So it would tell you that for this example, there are 2, a child and a spouse, 2 dependents for this employee, and you're able to get that added to the system a little bit quicker than if you have to reach out to each one of those employees. If you are using employee self-service through either Business Portal or the Dynamics GP web client, you can open that up to employees and they can enter in the information themselves. You would want to make sure that you have enough licenses to assign that to the employees, but in that circumstance, Pilar here could enter in Jay and Josh ahead of time for you in particular. It helps to minimize some of the data entry for the reporting purposes. So moving forward through the course of the year, all of that information has been held. So if we're running through the payroll process, you've run through payrolls through the course of the year. You get all the way till the end of the year, and you're going to run through the year-end wage creation process. That process will then take all of the information that's stored for both W-2s and ACA reporting and move that into the year-end wage file. At that point, you're able to edit all of the W-2 information if necessary, and along with the 1095 and dependent information. So you'll see 2 new buttons appearing at the lower right-hand side of that Edit W-2 window that reflects the 1095 and dependents information. Again, another way to take a look, if you've got HR installed, maybe you haven't had a chance to get through it at the beginning of the year. If you have HR installed, those 2 buttons will become lit at the end of the year after the year-end wage process. Also, running the year-end wage process is another way to check through the course of the year to find out if you are truly compiling all of the information necessary for the 1095 and 1094 reporting for the Affordable Care Act. I will say that if you do that, make sure that you do remove that year-end creation before you try to run payroll. It will throw an error message saying that the year-end has already been closed if you're trying to just check your information real quick in the W-2 window. In the Edit 1095 and 1095 dependence screens, again, it will allow you to change your coverage along with any of the line 14 or line 16 information. So if for some reason you've got some employee changes that needed to be made earlier in the year and it got missed, or you're validating the data and it doesn't quite look right, all of the changes can be done in those edit screens. One key note, though, is if you have to remove that year-end build and recreate it, all of the changes that you make in these screens will be lost. So you'll want to make sure that your year-end process is complete, all payrolls have been run before you're trying to go ahead and edit that 1095 information, because you will lose that data if you make some changes. Again, you can change the line 14, you can change line 16 information along with any dependent information. Along that covered dependents, you'll see that it does give you the ability to change the checkboxes. This, again, notes if employees or dependents are on coverage for one particular day in the month, it does reflect that full month. So, for example, Pilar's dependent, I don't have that in the drop-down, but could have been on coverage for January, February, March, off of coverage April through September, and then comes back on coverage October through November. So you would see some check boxes filled in there in order to reflect that. So again, that can be overridden in the Edit W-2s window. All of that data then culminates to running of the reports. Right below your W-2, when you go to print your W-2 window, there are some reports. It'll say 1095 and 1094 data for reports, but what that allows you to do is run their 1095s. So at this point, you can choose to run all of those out, maybe by the Social Security number or print selected employees, but the form is actually built into GP, so there's not any reason to go out and purchase any additional forms. All of this is printed directly on blank paper, so that way it helps a little bit with cost, but you'll see employee coverage identified here. Again, each and every one of these employees will need to get this report by January 31st. So for example, Pilar, again, was not on coverage January, February, and March, but was April through December. Is recognized 1A through line 14, line 2A for 16, and then the lowest cost premium would be for $100 throughout the course of the year. Part 3 of the report will list any employee dependents if, again, you are self-insured. So if you'll see that box in line Part 3, the box says self-insured coverage, add this checkbox. In that printing, it will ask you if you're self-insured, at which point it would print out all of those dependents. So employees would get a copy of this in order to file their taxes. So at that point, you can give them their W-2s and 1095s by January 31st. The employer report, though, is a 1094-C, also within GP in that same print year-end report section. Below the W-2s and below the 1095s will be a 1094 transmittal that will allow you to populate all of the information. So again, just as you take a look here, our example has the 29 1095s will be submitted to the government. One of the big questions is electronic filing. Electronic filing for W-2s and 1095s are required for employers over 250 W-2s. So again, now for ACA reporting, that's going to be any 50 full-time employees of which they'll need to be responsible. You will need to electronically file if it's over 250 W-2s. Dynamics GP, the versions 2013, 2015, and 2016 currently do not support electronic filing of the Affordable Care Act reports. There are 2 ISVs out there that do a good job of year-end reporting for 1094s, 1095s. Feel free to reach out to your account manager or associate consultant if you need some additional information, but Green Shades and Integrity Data will allow electronic reporting of those 1094 and 1095 information for those employers that have over 250 employees. A couple of helpful links for anyone. You can jot these down if you really want, but there are all kinds of resources out there from Dynamics, Microsoft regarding the Dynamics GP product, the IRS guidelines. There's a QA section on if you're curious of whether or not you need to report. There's guidelines from the IRS as to who needs to report, when that needs to be, what the fines are. And then there's actually a YouTube video out there from Microsoft on additional setups and items that can help you with your 1095 and 1094 reporting going forward. So there's all kinds of resources out there. If you have questions, feel free to reach out to your Dynamics GP consultant or account manager in order to try to get some assistance for that year end. The big key here, don't wait until the last minute. Make sure that you take the time from now till the end of the year to start putting pieces together for Affordable Care Act. Compile that data if you haven't started already. Start to set that up within GP so that you'll have at least a little bit of a head start for next year. But try to get all of that information together so that that way you're not late. The fines are very heavy for employers this year, probably set to go up again next year just because of the nature of the beast. So we would want everybody to take a look at that early along if we possibly can. So with that, I would open the floor. Lindsay, are there any questions?
There are. The first one is, do you still need to change the Dynamics date when adding the new codes to each employee as you did before?
That's a good question. So it is a nice little helpful hint. If you miss the date that you actually had that event happen on, then you can change your system date to rewind time or fast forward in time in order to get that in. So the answer there is yes, if you miss that actual date that you need to accomplish it on, especially as month end, beginning of the month, or end of the month, then changing your system date is still necessary in order to get that into the correct month.
And then a continuation kind of to that question. In the example that you showed, for January to March, Pilar wasn't covered. Should there be a code entered?
That's a good question. So it is optional from the current reporting whether or not that's covered. It's best practice to just leave it blank, but you're not going to get any complaints from the government if you're just reporting that they were not an employee during that period.
All right, and that is all the questions that are in so far. So a couple of additional items that we want to mention before we kind of wrap up today. All of our upcoming webinars and current promotions can be found on our website, associatesone.com. Our last 2 webinars for GP are December 6th and December 8th, both from 1 to 2 p.m. And then lastly, our current promotion that's running right now is first 3 months of hosting charges free through December 16th with K-Commerce. And then Feel free to reach out to Christopher or your account manager if you have any questions about anything covered today, and then his contact information is on the screen. And thanks everybody for joining us. We'll stick around if there are a few more questions, but if not, have a great rest of your day.
Thank you, everyone.